Hello, my name is Adelaide.
Hi, I'm Jasmine.
And I'm Caitlin, and we are here to talk to you about treatment options for obsessive compulsive disorder.
To refresh, obsessive compulsive disorder, also known as OCD, is characterized by distressing thoughts and repetitive behaviors that are interfering, time-consuming, and difficult to control. Obsessions are recurrent and persistent thoughts, urges, or images that are intrusive or unwanted. These usually cause anxiety and distress. These obsessions are what lead to compulsions, which are repetitive behaviors or mental acts that the person feels driven to perform in response to an obsession. The behaviors are aimed at preventing or reducing anxiety or distress, preventing a negative event, but are not connected to the event or excessive. Examples of compulsions of this disorder may include things like flipping a switch on and off, feeling the need to knock on tables, excessive washing and cleaning, repeating routine activities, or something along these lines of repetitive behaviors.
The objectives we have identified for this informational presentation for you and/or your family are to inform you on the importance of adhering to your medications and therapy for improved symptoms, describing non-pharmacological treatment options for obsessive compulsive disorder and combination therapy, and identify community resources in Lincoln and Omaha.
If you have already been diagnosed with OCD, then you will likely be prescribed medications as a form of treatment. Some of these medications would include, but are not limited to, Prozac, Luvox, Paxil, Zoloft. Do not stop these medications abruptly. It is important to adhere to your medications as prescribed. They may take weeks to months to become effective.
Another possibility for treatment will be your non-pharmacological therapies, such as exposure and response prevention, or ERP therapy, and the more recently adapted acceptance and commitment therapy, or ACT. Although ERP is an effective treatment for OCD, it is important to identify other methods to improve your adherence, completion, and outcome. For a number of conceptual and practical reasons, integrating ACT as well as your ERP therapy provides a promising avenue for those diagnosed with OCD.
Cognitive behavior therapy is another form of non-pharmacological therapy that would be suggested as first-line therapy. Therapist-guided, internet-delivered cognitive behavior therapy is a promising low-intensity intervention that could offer you access at home. Right now, this would be a wonderful option in COVID times. This would allow you to have your cognitive behavior therapy in the comfort of your own home. Now here's a short clip that explains cognitive behavior therapy more in depth.
Individuals suffering from OCD can undergo two types of treatments: medication, such as selective serotonin reuptake inhibitors, and therapy. One of the most common forms of therapy for treating OCD is cognitive behavioral therapy, or CBT. CBT is a short-term, goal-oriented psychotherapy that is used to teach individuals how their thoughts, feelings, and behaviors work in tandem and develops personal coping skills that can be used to change negative patterns of thinking and behavior. To help explain what CBT is, we arranged an interview with a physician that is trained in CBT. The C stands for cognitive, which refers to the fact that people have thoughts and interpretations and images in their minds in certain situations. It's how you think about things and perceive situations that dictate the kind of emotions that will follow. In anxiety disorders such as OCD, emotions are one of anxiety and distress, and are mediated by the kind of thoughts that people have. In the case of OCD, the thoughts are obsessions, which are the cognitions that we need to work on in CBT. The B refers to behavior, and the therapy focuses on changing aspects of the behavior that are dysfunctional and are maintaining the anxiety state. The therapy comes up from the point of view that the way we think about things and the way we behave around them will dictate the anxiety that we feel in those scenarios. Anxiety is maintained by the kind of distorted thinking that the patient has. If you break the cycle of distorted thinking and distorted behavior, we can get a breakthrough in the level of anxiety. The person starts to realize that they can enter a situation that made them anxious in the past and stay in the situation thinking more rationally. The patient's role is to stay engaged in the therapy. In order to break the cycle, the patient has to do a lot of work on their own. The work is done between sessions and is based on the idea that if you don't practice a skill, you're not going to learn it very well. CBT is a skill, or a set of tools that you develop for yourself and use when you need them. CBT takes about 12 to 14 weeks. The first few weeks are usually about gathering information about the person's particular manifestation of anxiety and doing psychoeducation around it. We gather information about the person's own form of OCD, what are their rituals, and if they have obsessions that bother them. Then we create a hierarchy of things that cause them distress. This is a tool that we use for the rest of the sessions. First, working with items on the hierarchy that don't cause as much stress, and when they become comfortable, move on to slightly more distressing situations. It's a graduated approach with dealing with the hierarchy. The person becomes more used to the concept of what they have to do. The patient becomes aware of when they are obsessing instead of doing it automatically. They realize that there's another way of dealing with the anxiety, that what's being taught in therapy is actually working, and can use their past success of overcoming their obsessive-compulsive symptoms in other situations. Sometimes CBT involves medication that can help at the same time while doing therapy. CBT is not for everyone. Individuals have to be very motivated to change because it is hard work and causes a lot of distress. In this therapy, you have to feel more distressed before you start feeling less anxious. Not everybody is ready to do something that difficult, and not everybody has the time. It also can't work for people too severe in their presentation of OCD, as their anxiety gets in the way of agreeing with what they need to do. They find that they are arguing and bargaining with almost everything they're asked to do, and are too anxious to complete the homework. Those people are candidates for medication, which would tone down the anxiety level so they could engage in the therapy. The advantage of CBT is that it really works well. I see such great improvements in so many people who are motivated and do the homework, and it really does work so well in people who are ready to make the commitment.
Now I'll elaborate on a resource for you here in Lincoln. Amber Ziesler is a licensed psychologist. She is located at 4535 Normal Boulevard in Suite 295. Her therapy includes education about obsessive-compulsive disorder, identification of specific symptoms, and gradual exposures to fears without compulsions, avoidance, or reassurance seeking. Individuals are not forced in any way to face their fears. Rather, she acts as a coach during the exposure exercises that the client plans together with her. As we've talked about previously, she also incorporates acceptance and commitment therapy, also known as ACT. Another community resource in Omaha that you can use along with your other treatment is group support. A great thing about Omaha Obsessive Compulsive Disorder Support Group is that it is free. The meeting day and time are Saturdays at 1 p.m. All you have to do is call Chris at 402-339-7991 to set up a free intake screening appointment. It is important to note that they do recommend all participants in their support group are already in therapy with a licensed mental health professional, as these groups sessions are led by peers. The support group does not replace therapy. Attending support groups and meeting with a licensed professional can be beneficial to you by having an outlet to speak out freely on what you are going through and to connect with others who are experiencing the same thing.
To summarize, what we want you to take away from this presentation is that it's important to understand that obsessive-compulsive disorder can be managed by adhering to your medications and getting involved with non-pharmacological therapy. Also, you are not alone and have resources available in your community to help you live with your disorder.
Thank you for listening.
We hope this gives you a better understanding of how you can live with your obsessive-compulsive disorder.